Assalamu alaikum, dear audience. In Meet the Expert session, we usually listen from an international expert on a very specific issue. Today, we are very delighted to host a scientist, an inventor, an innovator in the field of pharmaceuticals and in the field of medicine, in the field of pharmaceutical formulations. So today, we are very delighted to host Dr. Sanjay Agrawal. He is a pharma consultant and inventor from India. Today, he will be presenting his very unique pharmaceutical formulations which will help us to fight the elderly diseases. So before I do further, could you, sir, please introduce yourself with me and my audience? Over to you, sir.
Good evening. Thank you very much that you have invited me to speak on such a large platform, the audience, and given a very good topic also on which I can really speak well. As such, I'm a post-graduation in biochemistry, MBA in marketing from IMT Calcutta. I am full of passionate, capable, and desire to aid the patients through my innovative and unique formulations. I'm working for pharmaceutical industry since last 35 years as a medical and marketing consultant. Also attached to many publications, especially index publication as an editor, co-editor, editor-in-chief with Indian as well as multinational pharmaceutical houses like JAMA, BMJ, the antiseptic, the extra. I also writing a layman for the health issues on day-to-day their health problems. I strongly believe in core values on quality, reliability, and integrity. I am also illustrious member of National Geography of Society. In 1995, we developed the first unique formulation on paracetamol, that is 250 milligram in each 5 ml in syrup form. Normally, 120 milligram 5 ml was very popular all over the world because the 5 to 8 milligram was given per kilogram body weight to the patient that was well accepted by the clinician. But we developed 250 milligram 5 ml with the concept of 15 milligram per kilogram body weight, and we developed in syrup form and without propylene glycol and sugar free. To protect the liver, the concept was well appreciated by medical fraternity all over the world. I am a patent holder of 40 formulations. 17 formulations we have unique recently developed, but we have not gone for the patent. Some of the patents formulations are available with my multinational companies like Glenmark. They are marketing my patented formulation all over the world. Patented formulations are already available for the patients and results are quite successful. Today, my focus is more on nutraceutical due to safety profile is better than drugs, even in doses and more convenient to the patients and acceptance are well with the patients. Basically, by concept for developing any new and unique formulation based on two concepts. One, normally we develop such formulations where the line of treatment is not available for the disease in the medical practice, like pregnancy-induced leg cramp, thalassemia, etc. The other concept, we develop such formulations which is more safe and patient compliance rate is very high with the convenient doses. Thank you, sir. Thank you very much.
So perfect, sir. Very humble introduction of such a great scientist. So today we are going to listen, we are going to see your unique formulations. Those who you have already developed to fight the elderly diseases. Therefore, may I humbly request you to go to your presentation and present your inventions to me and my audience so that we, the audience of developing Bangladesh, as well as the business community of Bangladesh and globally, those who are listening to us, they can be known with your invention, and if possible, they can communicate with you to market your patented product in respective countries. Not only in Bangladesh, maybe one of my audience from Africa, one of my audience from East Asian countries, ASEAN countries, they can also communicate with you, maybe directly. I will give your email ID and other contact details in the description box of this video, as well as they can contact with me always so that I can connect them with you. Therefore, could you please present your inventions before the August gather? Over to you, sir.
Thank you. Thank you very much. As I mentioned in the introduction, normally we develop such formulations where the line of treatment is not available with the existing diseases. Number two, today our whole focus is on nutraceuticals, because the nutraceutical, the definition was different earlier. We were saying that nutraceuticals, those are available in nutrient which we are eating in the food, and we are using for the prophylactic treatment, prophylactic as a preventive. But now definition has changed. We cannot say that nutraceuticals are used only for prevention. We can cure the disease. We can cure. There are a lot of examples are there. Even during my invention, during my commercialization, I have seen we develop the product for the prevention, but during the post-marketing surveillance, we observe that our clinician, they cured the disease. For example, like pregnancy-induced leg cramps. We developed, when we were developing the formulation, we thought it will be prevent. The mother will not suffer with the pregnancy-induced leg cramps. But we have seen, after taking our formulation, the cramps were not there. Even after the delivery, when she delivered the baby. Even the sports cramps, very popular, diabetic cramps. When we starting developing the formulation, we were saying with the intention it is a preventive. But when the patient has used my formulation, the cramps were not there. So it was completely cured. Completely cured. So nutraceutical definition is different today. That's not used for the prevention or as a prophylactic. It can be used to cure the disease. Cure. My first invention, I mentioned that 1995, we developed the formulation on paracetamol in the liquid form with a 250 milligram in each 5 ml. Because before that, in the medical, the practitioners, they were writing 5 to 8 milligram per kilogram body weight of the paracetamol. And they were writing 120 milligram in each 5 ml. But we thought that paracetamol is normally used for symptomatic. So if we can give a loading dose.
One thing, would you like to present any PowerPoint here?
Yeah, the PowerPoint is not we develop because we normally feel
yes,
very
no
comfortable,
No problem, sir. Please proceed.
Yes, sir. So when we launched this product, 250 milligram in each 5 ml, with without any propylene glycol. The propylene glycol is normally, it was used extensively as a preservative. But we develop a formulation without propylene glycol, and propylene glycol is a very hepatotoxic. And paracetamol, in that time, the liquid was very popular in the pediatric patient, not adult patient. Now time has changed. Now we are writing the liquid form, even in the adult also, even in the geriatrics also, the viability is much better than tablet form. It is today's invention. So we developed this formulation, and well accepted by medical fraternity all over the world, and without sugar, no sugar we have used. So it was my first invention. Then we developed another invention, very popular all over the world. It was a uh, anti-cold preparation. Normally it has seen, and it has seen by our medical practitioners also, that the allergic rhinitis is a viral. If you give the therapy, it is good. The patient can maintain the quality of life. If you don't give the therapy, the patient will cure, only the time will increase and quality cannot maintain by the patient. Sneezing will be there, running nose will be there, headache will be there. So we developed a formulation with the nimesulide, pseudoephedrine, and cetrazine. It was very unique because that time the paracetamol was dominating in the market. We are saying in 2004. But nimesulide is really excellent antipyretic and analgesic. Number two, as a decongestant, we launched pseudoephedrine. Excellent results. And the action was very prompt. In short duration, patient was getting the relief. Cetrazine, before that cetrazine, the conventional antihistaminics we were using, anti-allergic, like CPM, clofamide, which has a lot of complications, drowsiness. Patient were not alert. He was not able to move into the office, or if the children are there, they are not able to attend the college or the school. So quality was not there. With this intention, we launched this product, the nimesulide, pseudoephedrine, and cetrazine. And doses were very convenient, 1 to 2 tablets in a day. And we have seen it within 3 days, patient was completely cured. As compared to conventional therapy, they were using 3 to 4 tablets in a day, and it is 5 to 6 days. The product was well accepted by the patent authorities, and it was granted in time, and the market share was taken by this formulation extensively. Then we introduced another very unique formulation, which is available all over the world, and already the patent was granted in time. The nausea and vomiting is very common, maybe due to the drug induced, or maybe due to the water or our food, any pathology. And we were using most of the antiemetic, the metoclopramide or their derivatives. So we launched a very unique patented formulation that was ondansetron, and that was in oral spray. So when we take with the oral spray, there is no need to take the water. You can easily, spray in the oral cavity. And while we are making the oral spray, the particles are already in nano form. This is a nano. So the penetration was good, viability was good. It is 10 times more potent than the tablet form, 10 times. And when you take the spray, it will spread in the mucosa, oral mucosa, within a fraction of seconds. And most important, that you will not take a glass of water or any oral preparations because you do not know what type of water you are taking. Is hygienic or non-hygienic. And there are certain conditions while you are traveling and water is not available, unfortunately. Or you are in the office, or you are in the school and college, or sometimes the patient is hospitalized and water is contaminated. It can aggravate your nausea and vomiting. So we launched this product on densitron oral spray, very much successful. And even today also it has taken a big market, not in India and most of the countries. As I said, my many formulations, patented formulations, are marketed by multinationals. So this product has taken by Glenmark, and I'm sure this product must be available in Bangladesh also. We have introduced another formulation that is a very unique because our ideology is always we look safety, tolerability, and patient convenience. My back of the mind is always remain the whatever my invention is there, the patient compliance should be good. Patient compliance in any way, either in the administration or either he can easily carry my formulation to anywhere. Even the administration, he should not use my water or anything. No supportings are required, or supporting should not require. That is in our back of the mind before we develop any formulation. So we did develop another formulation that is a mouth melting spray on the different vitamins. It is established now. The vitamins are not placebo. They are used for the treatment of the disease. And we really require vitamins sometimes because vitamins are very important as a coenzyme. Basically, until as we don't have vitamins, probably our chemical reaction will not be get completed. So we develop many films, very tiny films, which you can keep on the tongue, and through the tongue, they get absorbed, the drug will get absorbed, and it will reach in the blood circulation, and then the entire my pharmacology will start in the body. We tried a number of vitamins, but most successful was B6 was our first product, which we have gone for the patent. And we checked the bioavailability. The bioavailability was much better. It was 10 times better than tablet form. And apart from the bioavailability, apart from the efficacy, the administration was very convenient. You can carry in the pocket a small teeny film. You take out the film, you keep on the tongue, it will melt immediately and it will reach into the system, and the pharmacological aspects will start in the body. So it was a wonderful product, and safety profile was good. No water was required, and the convenience was there, patient convenience, without any complications, And I mentioned that most of the time we have spent our life in the nutraceutical as compared to drugs. Due to variety of reasons are there, variety of reasons. Then we develop a very good formulation under the drug, that is misoprostol, and for vaginal supercity. Vaginal. The vaginal supercity, it was through the vagina, the female can easily administer the formulation, and this misoprostol is a very popular drug, It was used earlier for the abortion. Very popular. And the medical fraternity, they were very happy with the migestrol